Hello, hi, I'm Sarah. I work at a physiotherapist office, and today I would like to introduce the Dorn method to you. I know most people haven't heard of it yet, and I think it's more popular or famous and known of in Europe, especially like in Germany and countries around Germany, since it was developed in Germany. Um, First, I would like to explain that this form of physiotherapy anybody can learn. There are ways to learn it, like from books. We wrote a book, or my cousin is a physiotherapist, and he's been working with the Dorn method for the past 20 years. And he's wrote a book about it and explained exactly how you can do the exercises yourself. I'm sorry, I have to adjust my camera. um, so basically what it is, like, we all suffer from the same problem, like when we sleep or we work, like sitting at an office a lot, or we misload our bags when we lift things. Our vertebrae shift, like especially in the neck area it happens a lot, or in the lower back, and then it causes us pain and lumbago and all kinds of stuff. And then we get headaches and other symptoms that show from that shifted vertebra. So usually what we do is we go to a chiropractic, or we go to the doctor, and then he fixes our neck or whatever is in pain by cracking our bones. Like, he just grabs your head and then he goes like and then you hear that cracking noise, and then everything is back to normal usually. Sometimes you have to go back, but then it usually works. The thing with that is it's really not, it's a method that works, but it's not an ideal method. There are like more smoother way for the body to do this. And every time somebody cracks your bones, it's kind of like a shock experience for your body and your nervous center, and that information goes to your brain, and then like every time somebody touches that area again, your body reacts with a oh my god, like you tense up and your muscles get all stiff, and then you can actually eventually cause more harm than you do any good. With the Dorn method, it's a little bit different. Like, you actually put the vertebrae back into their original place using the natural movement of the body. Okay, so I know this sounds like it's kind of hard to imagine the way it sounds, but we will get into that further in the following videos. But right now I would like to show to you like actually what the spine looks like from inside. The spine is actually, it's kind of like split it in three departments. Here you have the cervical spine, which contains 7 vertebrae, like starting here at the top at the atlas, going down to the 7th vertebra. And then after that, like the thoracic department starts, which contains 12 vertebrae, starting here at 1, 2, 3, 4, 5, 6, 7. Women oftentimes have a lot of problems here. This is like where your bra strap is sitting, and then going all the way down to the 12th vertebra, and then finally you have the loin vertebrae, which are like 5 of them. Then the sacrum. Most of us, like when we have lumbagos and stuff, then we usually suffer from pain around the sacrum and the tailbone, which builds the end of the spine. Okay, here also you see like the ischias nerve. I'm sure everybody knows about that. This is actually where what causes the pain in cases of lumbago. Here it's like it goes all the way down to the feet, and like when it gets squeezed or blocked somehow, that's when that electric pain that you feel, and it's like really, really horrible, where you cannot move anymore. So the Dorn method, it contains of really just your hands. Basically, is like the most important tools that you use for that is your hands, especially your thumbs, sometimes your fist too, but usually you work with your thumb. And also what we will get into like much, much later is the cupping. Some of you might heard of that method too. It's like from the old Chinese medicine. It's like traditional medicine. It's called cupping. Back then they used to do it like with needles, or like they used to use like little cuts of the skin and like have the blood sucking out. I know it sounds really gross, but these days we don't really do that anymore. Maybe some people still use the old method, but now we do it bloodless. So don't worry about that. All you use is like little plastic cups. They're like translucent, and then you place them on the vertebra like here, or sometimes even like next to them, like on your shoulder blades, or next to the sacrum, like here where like other joints are. You can place them here too. And then basically you just like with under pressure, you create some kind of vacuum, and that way like it puts the joints or the vertebrae back into their natural position. But we will get into that much later. I don't want to say too much right now, so you're going to be like, oh my God, Sarah, I'm totally confused. What are you talking about? So right now we're going to stay with the Dorn method. And the great thing about it is, just like I said in the beginning, that really anybody can learn it. Like, of course, you have to get supervision first by somebody that's actually trained to do it, by a physiotherapist or somebody that's been doing it for a very long time. And then you can do like self exercises where you don't really need nobody else but yourself, using the door frame, for instance, on your back, or your own thumb and hands. That's all you really need. And it's like, it might sound a little confusing in the beginning, but once you actually get a grip of it, it's pretty easy, and really everybody can learn it. I will introduce it like step by step to you, but right now if you have any questions on anything about the Dorn method, please just like ask me down below in the comments, and I will explain it to you. So until next time, and the first intros or first explanations of the Dorn method, I wish you a great time, and I will see you later. Bye!